Hello, welcome to Big Derm Energy, episode 5. Today we're going to be talking about acne scarring. You ever wondered what it takes to make, market, and distribute skincare products that really deliver? Well, we've been at it for over 5 years, and we can't stop talking about it. Join us as we separate the facts from the fads. Today's guest, Dr. Steve Ship. It's episode 5 of BDE. Today we're talking about a common side effect of acne scarring. Welcome, Steve.
Great to be here.
Acne scarring, Steve. This is definitely something we get lots of questions about, both from our customers, but also from like our influencer and creator partners. So tell me a little bit about what is acne scarring, what causes it, and also just like what's the difference between acne scarring and hyperpigmentation, another term we hear often around this topic.
Yeah. So acne scarring is like any other scar, right? It's a result of a wound, right, that did not heal like perfectly, right? You get a burn, you get a cut, you can scar, right, if it's deep enough, right, or the wound's big enough, right? And ultimately with acne is also an injury to the skin, right? If you have a large acne lesion and it causes, a lot of inflammation and issues, or you pick at it, which can cause, worsening of the wound or issue, it may not heal in a way that is perfectly normal, right? And so you have various different types of acne scars. Sometimes you have larger scars. Sometimes you have these ice pick scars, little small divots, right? Sometimes you have bigger scars. Some people have, issues with scarring when they do scar comes back larger and bigger than the original wound, called a hypertrophic scar or a keloid. That can happen in more individuals with skin of color. Right? I can see that a lot as well. So acne scarring is a result of acne, various different types of acne scarring, right? Then, is permanent if it's not treated.
And do different types of acne cause different types of scars, or is it more around like how you are treating and picking at the acne that is causing the scarring?
All different types of acne can cause all different types of scars, right? And so, there are, cystic acne, so the deeper spots, right? They can typically cause larger scars, but even smaller scars on the surface can cause other scars as well, like the acne lesion. So I would say it does depend on the severity of your acne, right? The more severe the acne is, more frequent, more deep, more number of lesions, like that's going to increase your risk of scarring, right? Overall. So if it's only superficial, a couple spots, a little bit less common, but scarring is just directed to how severe the acne is.
And in terms of where on your face you're getting the acne, does that depend on the scarring? Are certain types of skin more susceptible to scarring or parts of the skin?
Well, I mean, the face is just most visible, right? Acne happens on the face. Cheeks is super common. Foreheads happen, but probably cheeks are the most visible. Seen it on the nose. I see a lot of scarring on the back as well. People with a lot of acne scarring on the back or chest. So scarring can happen anywhere you get acne, right? But obviously the face is going to be the most visible, right?
Uh-huh. So, your skin does renew by itself in some senses, but like, what are some of the other short-term and long-term solutions that people could use to treat scarring?
It depends on the type of scarring, right? So if it's a little bit more superficial, you could do something like a chemical peel. That's usually done by a dermatologist. It could be like colic acid or salicylic acid at a higher percentage than what you get over the counter. So that just kind of helps with the top surface to kind of smooth it out. There's dermabrasion, which uses like sandpaper that can sort of help with that. Lasers, like certain lasers are effective for acne scarring as well. There are also things called subcision. You actually have like a procedure where you cut and break up the underlying scar tissue in the skin, and that kind of helps with those sort of more depressed acne lesions. So it kind of makes the skin a little bit more smooth. There's things called fillers, right? You can inject to like raise up acne scars so there's no divots in your skin. So lots of different techniques, right? There is also microneedling, like little microneedles can help rejuvenate as well. That's for more superficial. So you can use chemicals, you can use lasers, you can use surgical procedures, you can use fillers, right? These are all different ways that can address acne scarring. It depends on the kind of acne scarring you have. It depends on your skin type, right? It also can depend on your budget, to be honest, right? All the kind of things that sort of add up to address acne scarring.
Mhm. And what about on just like a day-to-day basis? Like, as you're treating your acne and your oily skin, if you're noticing that you have some scars, some hyperpigmentation, are there specific ingredients and things within your daily routine that will help with it over a long-term period, in addition to kind of like those one-off treatments that you suggested?
Yeah. So the key thing is to address acne scarring, address the acne. That's really important because it doesn't matter, right? Like if like you have all these scarring, but you keep getting acne, like you have to address the acne, right? And this is where I have people with severe uncontrolled acne and they have scarring already, and they're asking me, "What do I do, doc?" It's like, let's get the acne under control, right? Let's you know, there's no point, right, in kind of continuing to take water out of the boat. There's like a hole in the boat, right? You got to plug the hole first, right? Deal with that first. And that's a good regimen for acne treatment first. And then let that all settle down where it's, you know, you're not getting more acne that's causing scarring before you invest in the time, money, energy, right? To kind of like address the scarring, right? So that's sort of the number one thing is like the best way to treat acne scarring if you have active acne is to deal with the acne first and then, think about acne scarring after. Now, hyperpigmentation is very different than acne scarring. Hyperpigmentation is not permanent. It's discoloration, right? That kind of fades with time, but sometimes it can take months or even years, right? And so in those cases, especially in skin of color, when you have dark spots from acne, that's not scarring, but just those kind of splotches, right? You can't feel the difference. It just has different color. Then you want to do things like sunscreen, right? You don't want those spots to get darker. That makes it more accentuated.
Uh-huh.
And things like kojic acid, like lightening, skin lightening, which we have in our eye cream, right? That can help, with the lightening.
Interesting. So preventing acne scars from happening is really about treating, the acne in the first place.
Yeah.
How about preventative in terms of the way, if you do have acne, how you're treating it? Like if you're using hydrocolloid patches, for instance, or our sulfur cream to spot treat, pimples, that's obviously going to help significantly over popping those pimples, right? You would never recommend popping a pimple.
I know it's really, really tempting, right? But usually with popping, like you're going to create more injury, more inflammation, more skin damage, increase your risk of, having a scar, having hyperpigmentation. So, in general, I don't recommend, your hands, right? Those hyaluronic dressings, those pimple patches, I mean, they help get inflammation away by like absorbing some of the fluid, the inflammation, the pus, like these kind of things. That helps decrease, right, the inflammation, the discomfort, helps you prevent from picking. That's one big advantage of those things. But also, definitely, I think has an advantage of preventing the acne lesion from getting too big or becoming more difficult to handle and creating a little bit less inflammation, right, which then drives lesser risk of acne and scarring. Retinols are used as sort of anti-scarring, right? They kind of help with collagen neogenesis and they kind of help with some levels of scarring. It's not like I wouldn't say use retinol for scar, right? Because I think there's sort of limited benefit, but it does help a little bit, right, in terms of addressing some of that. That's something that just is part of acne treatment as well, right? So I think those are kind of ways that you can think about it.
Interesting. I mean, when you go to the drugstore, you oftentimes see, a scar specific cream, right? What are the main ingredients in that? How does that work compared to like a retinol or like a daily skincare routine that, someone would have with, a geology product?
I think that the data is really speckled on these over the counter scar treatments. Maybe the best data is silicone gel sheeting, right, for wounds and these kind of things. I think it's largely impractical to have that over your face, but I think that data is some show that it helps, some that it doesn't, right? It's not a great treatment for it. I mean, it's available in your drugstore, but it's not something that I typically tell my acne patients to go get just because the data and evidence of its benefit is not really there, right? And there's some scar creams and other kind, and mostly they're moisturizers, right, which can kind of help the appearance, soften scars, but they're not really going to address and improve a scar dramatically. That's typically a little bit more like go to your dermatologist for some of those other treatments that I mentioned earlier. Yeah.
Mhm. So like if you're just letting, yourself in your daily routine, you're treating your acne, how long does it typically take for, minor acne scars to just fade, with your daily routine? And when would you recommend really like to a patient doing one of these other, treatments?
Well, look, scars are definitionally permanent, right? So they don't like there's things you can do to make it look better, right? With moisturizers and retinols, but like scars are scars. Once you have a scar, you always have a scar unless you physically remove it or do some kind of treatment to it. But like ultimately, there's no cure for scars, right? You're gonna have it. Um, so I think that's an important thing. Obviously, like I said, there's things that can make it look better, right? Sometimes you have scarring and hyperpigmentation, which looks the worst, right? Because you got a scar and it's dark, right? So the hyperpigmentation does resolve, usually, right, with time. That lightens and your normal skin color. So that's one way that scars can look better. That's what I kind of seen, right? Especially my darker skin types. But I think that's an important sort of distinction and point. Yeah.
And would you recommend some of the similar treatments for like sunspots, for instance? I mean, because it sounds like it's kind of in a similar realm.
Yeah, I mean, sunspots are like freckles or these kind of things. I mean, they're they do respond like skin lightening creams like kojic acid or hydroquinone, right? So I think that's something to kind of think about. Sunscreen is very important for those, right? To
Okay.
make sure they don't darken, you don't get more of those, etc. Yeah,
Interesting. And does sunscreen have any effect on, acne scarring?
sunscreens have effect on acne scarring. Um,
Like, say you can't resist, Steve. You pop that pimple, and you're seeing you have a little mark. Exposing it to the sun, is that
yep.
going to make it more visible, keeping it protected from the sun? Could it help?
Yeah, I mean, I actually don't. I mean, it usually because hyperpigmentation and scarring can kind of come hand in hand, right? That protecting it from UV radiation generally is a good strategy. Yeah.
Excellent. Well, thanks, Steve, for talking to me about acne scarring. This is definitely something we get a lot of questions about, from our customers. Before we jump off of this episode, any general advice in terms of acne scarring? I know you mentioned a lot of different solutions, but just, taking care of your acne, treating your acne, any general advice on how to prevent and treat acne scarring?
Don't panic. We can
Okay.
address scarring. Treat the acne first. That's really important, right? And then after it's all settled, then there's options, right? Both from a dermatologist in general, right? That will be able to help, right? From peels to lasers to procedures. So we can make a big difference in acne scarring. But the key thing is to treat the acne first, prevent it from happening so that you don't have more scars to deal with at the end.
Great. Thank you, Steve, for joining us for this episode of Big Derm Energy. Really appreciate your time here.
Thanks.